Decisions about insulin, diabetes technology, education, and insurance are often made in rooms most of us will never enter. And that can make advocacy feel like a job reserved only for policy experts. But your lived experience may be actually the most valuable thing you can bring and is often the missing piece. Today, I'm talking with Susan Weiner about how small, practical actions can help move diabetes policy forward, even if Washington isn't in your plans. But before we continue, I need to remind you that we're not providing medical advice or endorsing any specific products or brands. We'll always encourage you to consult your healthcare team for personalized guidance. Susan, it's so good to have you here. We've known each other for a long time, so this feels less like an official podcast interview and more like a chance to catch up about something we both care deeply about. Thanks so much for joining me.
Absolutely. It's my pleasure. I welcome the opportunity always to chat with you and catch up, and especially about advocacy. I can't wait for this conversation. I'm excited.
Thank you. Thank you. You've spent so much of your career making diabetes information more practical, compassionate, and human. But I'd love for our listeners to hear it from you. How do you describe the work that you do, and what's kept you so connected to the diabetes community over the years?
A lot of the work that I do is taking practical information and scientific information and turning it into strategies for everyday life. And whether that's with a client or a person that I work with that lives with diabetes or another chronic condition, and for healthcare professionals, there's a lot of information there. I love to turn everything into real life, what actually works for people in their life. So that is all about collaboration. Nothing should just be told to a person. Everything is about collaborating and meeting a person where they are. And all of the work that I do in diabetes is to support people who I love in my family and my friends who live with diabetes, and people that I've met over the years, just like you, who are living with diabetes, hearing your stories and everything that you do and things that you're passionate about. I stand behind and I advocate for. And that's really what my work is about. And whether that's one-on-one working with somebody or working on committees, speaking, writing, all the events and organizations that I work with, it's just what I love to do, what I'm very passionate about. I hope that comes across.
It definitely does come across, Susan. You're like a beacon that has been there for solid, compassionate diabetes care for as long as I can remember. So it means a lot to me to have a chance to catch up with you again. You recently joined advocates from across the diabetes community at DPAC's Community Hill Day in Washington. And some of my Blue Circle Health colleagues, including Len, Sarah, and Sherry, were there too. And we'll use that experience as a starting point today. But our larger conversation is really about making advocacy feel more approachable, really wherever and however someone chooses to participate. So before we get into what happened in Washington, I'd love to understand how advocacy became a part of the work that you're doing. Was there a particular experience, maybe a person or a recurring barrier that made you realize that helping people individually really wasn't enough, that broader change on that advocacy level was also needed?
Interesting point, Scott. I love that you asked me this question, because we don't think of advocacy all the time in the smaller sense. We just go completely full on to the higher policy level. But the truth is, as a diabetes care and education specialist in private practice and as a registered dietitian, I am always advocating for one-on-one with the clients, the patients that I work with, whether it's for an insurance denial or not having medical nutrition therapy, or wanting them to be able to have their children screened for type 1 diabetes, for a whole host of different issues. So a lot of that came up. But in my practice, I know we'll talk more about this, of what happened when we went to Washington. I really was alarmed at people who need medical nutrition therapy because of my work as a registered dietitian, and not understanding what medical nutrition therapy is, so that is something that people are missing out on. It's not telling people what to eat. It's advocating to help them take whatever is going on medically and translating that into the information that they need. And a lot of people lose access to medical nutrition therapy or MNT when either insurance changes or they're on Medicare. So that is something that I'm very passionate about, in addition to getting screened early for type 1 diabetes, insulin access, the Obesity Care Act, Chronic Care Pain Management Act, and all of those other things. But that's something that's often overlooked and makes such a huge difference in people's life. It's all about what you eat, right? A lot of the times when you're looking at different pieces and how that is affected by your culture, your budget, your lifestyle. So that's one thing that I'm very passionate about that is often not talked about.
Yeah, absolutely. As a healthcare professional advocating alongside people living with diabetes, how do you contribute your deep expertise in all of those areas while also keeping the lived experience and patient voices at the center? That's something that I see you especially strong at.
Well, thank you for saying that. To me, advocacy is standing beside a person with diabetes, alongside a person who is living with diabetes, to support what their goals are. It's all in collaboration. And into that, I bring more healthcare professionals, people on the healthcare team who never thought about what advocacy means at all the different levels. So a person's lived experience, a person's story is what is important in making changes. And the more that people get into the conversation, all of our voices together, that's what makes a very big difference. Not one person's small voice, but everyone's voices together.
Yeah. What do you think most often keeps people from becoming involved? And what would you say to someone who maybe worries that advocacy is too political or too big or too time-consuming or complicated for them? It really ties into what you just mentioned, that it's leveraging those small voices, but together it makes a big difference.
One of the big ones, just to get started with, is that people don't think that their voice is going to be strong enough, and that it might be time-consuming, and that they're not a policy expert. The truth is that your lived experience and your story is what is going to stick with people. That is what people remember, a specific story, and they can relate to that story perhaps not only through, and this is at higher levels, not only through your story, but how that might have affected a family member, a community member, and at levels of senators and congressmen, how it affects their constituents. We are all constituents. So getting started at whatever point you're ready to get started at is so important to share your voice. And then that also inspires other people to share their voices.
Yeah, very true. When the opportunity arose to participate in DPAC's 2026 Community Hill Day, what made you say yes? What were you hoping to learn or contribute through that experience? And we're going to start kind of digging into what that looked like for you.
So I am on the Scientific Advisory Council for Beyond Type 1, and this is a volunteer role that I'm so passionate about, and they do such great work. And they are supporters and partners with DPAC. So I came with the Type 1 group. They're the first ones to reach out to me to participate. So that was an amazing experience to go with all those champions of Beyond Type 1 with DPAC. But DPAC does such incredibly important work. And I believe in their vision, their policies, and their support to make changes. And so I was inspired to come to Hill Day.
Yeah, wonderful. Well, let's take listeners inside the experience a little bit. Most of us only see like the photos afterward and the social media posts. So let's talk through what actually happens during a Hill Day. So many of you arrive in Washington. How did DPAC prepare this amazing group for those meetings? And what were you reassured that you maybe didn't need to know? You mentioned like you don't need to be a policy expert, right?
Right. So before we even came to Hill Day, DPAC did an amazing job of sending us tutorials, videos. We even took a prep quiz so that you can see if you had a good understanding of some of the basics before we even arrived. And when we had our preparation day, which is the same day we arrived, we went right to preparation day, which was the day before we went on the Hill. This was jam-packed with incredible information. So we received a great folder, which I actually brought. I don't know if this will translate well, but this is the folder that we received. And the reason that my folder looks so messy is because I use it. I still use it. It has incredible information in it.
Yeah.
And it was great. So the day involved going through in a very organized way, discussion of what to expect, but also through all the different bills so that we would have a good understanding of what are the bills that we can discuss when we're meeting with the different staff in the different offices, which was incredible. We were even able to view, they put on a little mock role playing, what might happen in the meetings. And then at the end of this fantastic meeting day, we were able to meet with our groups. I'm from New York. And because we are all in a larger group from New York, our New York group was split into 2 groups. And in my group, I had the privilege of working with Sherry and with Sarah, which was phenomenal. We really did a great job together. It was fantastic. Everybody had different strong points, and together that worked amazingly well. So at the end of the day of learning everything that we're going to be seeing the next day, we met together in our small group. Why this was very important is that we wouldn't speak over each other and we would each get our points across. We each took a different piece that we would focus on in the meetings, also knowing, and DPAC totally prepared us for this, not to be upset if our 30-minute meeting was not a sit-down meeting. It could have been in the hallway, which 2 of our meetings were. If it wasn't 30 minutes, it could have been a 5-minute meeting. And we prioritized what we wanted to get across. So I do not live with type 1 diabetes. People who live with type 1 diabetes may have talked about their diagnosis story and why it's important to them to promote the early T1 screening bill. I spoke about diabetes self-management training and support and medical nutrition therapy as a way of an example. So we all had our pieces, and it really was seamless and phenomenal. And I wanted to add, Scott, that an excellent thing that DPAC also did was a really basic do's and don'ts of what to expect.
Yeah.
And what was one of the don'ts, which was great, please don't expect to meet with the actual senator or congressman. You're going to meet with staff. And that's super important because they're really going to have the time to listen, and they're going to relay your messages directly. They have the ear of the senator and or the congressman. So that was really helpful. That was great.
Yeah, I can only imagine, how important it is for DPAC to sort of set those expectations for you. So take us into your, you got that day of preparation beforehand, and then you walk into your first meeting. What was that like for you? Did it match what they described? Tell us, take us through that.
All of these meetings were very exciting. And even with everything, anybody could think whatever about what's going on in Washington, and we all do. And there's a lot happening in Washington. It's very awesome to walk through these halls and to see everything. It's a fantastic, excellent experience. Even though it might not have the outcome as immediately as we would like it to have, we know that sharing our voices over time will have an impact, and that's what we wanted to have. Our first meeting was with Senator Gillibrand's office, and that was very exciting. And that staff member was phenomenal and very interested in any and all things diabetes. We had our full 30-minute meeting, and it was our first one. So we had decided before we went in who would take the lead, introduce us as a group, what we were there for. Although they have it on their agenda, we took 30 seconds to explain that and share our names. They shared their business cards. It was really an excellent experience. And we went through our discussion points, taking a breath so that they can ask questions in between. And this meeting went phenomenally well because that staff member shared a personal story about a family member with diabetes who would have benefited from the Early Screening Act. So this was a fantastic conversation, and we left that feeling really great before we went into our next meeting. Towards the end of the day, and I think this is important for people to hear, we had a meeting with a person that was not the staffer that we expected to have the meeting with, someone who probably had this position for, I don't know, all of 30 minutes. So we met in the hall, standing up for 5 minutes, and we kept it very simple. Only one of us spoke. We knew to do that. I'm glad it was the last meeting of the day. And we left it with that. We really, and of course, we sent thank yous afterwards via email. We left it with, please, when you settle in, contact us anytime or DPAC for more information. So that went really well. It was a great learning experience.
Yeah, and it sounds like you were well prepared for just being able to stay on your toes with those last minute changes or having to take those hallway meetings. During those meetings, whether you're first or last or anywhere in between, were there moments when you noticed a staff member lean in or ask follow-up questions? You described how that first one, there was that personal connection.
Yes.
What did your experience throughout the day teach you about the role of those personal stories?
Personal stories were everything. And when people, even on your team, Sarah shared her personal diagnosis story, and they took that away. Every time she shared it, that very much impacted them. And they were able to relate to that. And they were able to say, really, we didn't know that. We're going to take that back with us. In terms of Diabetes Self-Management and Training Act, they really took that away as well because of the need for that and the need for a breaking in care. The Diabetes Act, which it's an acronym for a very long bill, so I won't go through all that. But what it talks about is when people's insurance change, their diabetes care doesn't change. They may be on the same technology and insulin pumps for many years, and all of a sudden they're on Medicare and they lose access to those technologies, which affect everything. So I spoke a lot about that when I saw their ears perk up about a family member or a community member that went through a change in their insurance. So we leaned in and stayed very flexible. That's part of my role in what I do during my career as well, to follow the meeting to where it went. And they were mostly extremely interested in what we had to say. And you have to take it also, Scott, I think that they're going through these meetings all day long. Right. So if you leave them with a story or something that's important that they can relate to, that's what will resonate with them. And DPAC also did a fantastic job of giving us the bills and the numbers of the bills so that if they needed further clarification after our short meetings, they were able to quickly find it. They didn't have to look it up, really scour through things. The information was all there, and we left them with information as well, all provided by DPAC.
When the meetings were over, did you feel like your participation had made a difference? And talk to me a little bit about what happens after Hill Day.
I felt that we did make an impact. And when we met with people that evening from all the different states from all over the country, they felt the same way as well. And advocacy does not end when you leave a meeting like this. Advocacy does not have to start in a meeting like this. If you're thinking of doing advocacy, anybody who's listening today, join an organization like DPAC or whatever professional organization, community organization that you feel would be a good match for you, and sign up for their action alerts. Watch one of their videos on updates on what's going on advocacy. You could sign a letter to your congressman or your senator. You can go to a local town hall meeting. You can send an email, much of which will be templated for you through a group. It's already done. So DPAC gave us excellent information on how to follow up either with a letter to an editor or doing something locally, which is really what matters. Sending an email and follow up. Again, staying on top of action alerts, because this is what people who are elected officials are looking at. But start with whatever works for you, and please do not be overwhelmed. Don't look at this as something that's overly time consuming. What's not good is just to sit idle. Any small thing that you do will make a difference if many people build their voices together. I truly believe that.
Yeah, that comes through loud and clear. And thank you for pointing that out. All right, I feel like this is a good place for us to take a quick break. And when we come back, we're going to keep going into what you just mentioned, Susan. We're going to move beyond Capitol Hill and talk about practical ways that each of us can participate, even with limited time, energy, or experience. One of my favorite things is sharing a quick story from someone who's participated in the Blue Circle Health program, and we have one today from Isora.
I was diagnosed last year. Oh, you're type 1 diabetic. You're a LADA. And I'm like, excuse me? And she's like, yeah, your whole life's going to change. She said it so casually that I didn't have the information that I needed. I had so many questions. I felt alone. I was in this massive learning curve, and I was experiencing things I'd never experienced before. I was just flying by and Googling things. And this girl looks at me and goes, are you type 1? She was like, oh, it's going to be okay. And she was the one that told me about Blue Circle. It's a total night and day, like a conversion. They modeled things for me. They held my hand and they showed me, this is what we do. This is how we do it. This is the process. And that was amazing.
Thank you, Isora. Before we get back to my conversation with Susan, I want to point you towards a few organizations that can help make diabetes advocacy feel much more approachable. As we're talking about today, the Diabetes Patient Advocacy Coalition, or DPAC, helps people understand the policy decisions affecting diabetes care and turn that knowledge into action. They offer, as you hear Susan describe, training, action alerts, and opportunities to share your experience with policymakers at both the state and federal levels. The American Diabetes Association also has a broad advocacy program focused on issues such as affordable access to insulin, medications, technology, healthcare, and protections for people living with diabetes. Breakthrough T1D is probably best known for its work supporting type 1 diabetes research, but advocacy is also an important part of its mission. Its advocacy team and volunteer advocates work to support government funding for T1D research and policies that improve access to treatments and technology. Now, you don't need to join every organization or take action on every issue, but take some time to explore what each group is working on and see whether one of their priorities connects to something that you care about. Blue Circle Health also has a couple of recorded webinars that can help you go deeper. Advocacy Made Simple, an introduction to diabetes advocacy with DPAC, explains how policy advocacy works and offers practical ways to get involved and introduces you to some of the leadership at DPAC. And then in Everyday Advocacy, Small Ways to Make a Big Difference with Type 1 Diabetes, Steph Ash, who is an advocacy powerhouse, explores the many forms advocacy can take in healthcare, at work, in communities, and in our everyday life. And we'll link all of these organizations and both webinars in the show notes. So pick the resource and the level of involvement that feels right for you. One more quick thing before we return to the episode. Blue Circle Health has been nominated as a finalist in the 2026 Impact Awards. We're incredibly honored and excited for the opportunity to help even more people with T1D. But we need your help. Every day from now until August 14th, please visit redsox.com/impact and vote for Blue Circle Health. We're in the New Hampshire category. You can vote once per day, and every vote, every day counts. Thanks so much for your support. Welcome back. Susan, before the break, you took us inside DPAC's Community Hill Day and showed us what advocacy can look like in Washington. But most listeners may never attend a Hill Day. And as you mentioned, they shouldn't need to. Let's bring this conversation home and talk about some practical, everyday opportunities. So if someone cares about improving life with diabetes, but maybe feels overwhelmed or unsure where to begin, what's the smallest meaningful step that they could take?
So important to have this discussion, Scott, isn't it? Because people just don't know where to start. And when they do see the pictures from Hill Day, they're like, oh my goodness, do I need to start there?
Yeah.
No, you don't. It might be something that you will eventually do or want to do and have the opportunity to do it. But no, get your feet wet in a place that's comfortable for you. So I want to mention that DPAC has just updated their advocacy toolkit. So even if you reach out to them and look at what they provide as an advocacy toolkit, that can be a great thing for you to browse through and see what's there. But look at the advocacy updates from various organizations. So because of my interest in diabetes, I look at the DPAC advocacy updates and participate in those. And I also look at them through my other professional organizations like the Academy of Nutrition and Dietetics, for example, to promote medical nutrition therapy, which DPAC does as well. I look at those through the Obesity Association to see what some of their advocacy might be as well. And I also have so many people that I collaborate with who live with diabetes, who are on GLP-1s. And that's another interest of mine now because their lack of medical nutrition therapy access is now changing because they may be on GLP-1 therapy. So there's a lot that goes on there. But start small with those updates. And you will also see in joining them that something as simple as social media updates can be shared. That's something that you're interested in if you're working with a group like DPAC or another group, like I said, the Academy of Nutrition and Dietetics I work with as well, on their policy updates, the Obesity Association as well, to look at that. You can write a letter to the editor of a local paper. DPAC in their toolkit gives you a template of a letter, and they also offer that they can look at it and give you pointers on it. They tell you how long it should be, who you should write to, the language you should use. It can all be done for you that way. But I also like in person. I think we all do, right, Scott? Like after being separated for a long period of time, sometimes we like to see each other in person. Attend a local town hall meeting if it is a subject that you think that you can share something that you're passionate about, or at a local library or at your church. This can be something that can be so incredibly helpful for your community and to raise awareness. So those are the places that I would start. Nothing has to be polished. Polished is not always great when it comes to sharing your story. It's great to share it from the heart, what you're passionate about. And another piece I want to share, don't worry, you don't have to overshare. If you feel that something is too personal, tone it down a little bit. Share what makes you feel comfortable.
Do you have any thoughts or tips there? If someone wants to share their experience, I think that there's this sense that it needs to be this clear, polished story that's quick and efficient, but how can they sort of work through what's in their head and their heart without feeling like they need to become a polished speaker or maybe disclose more than what feels comfortable?
Excellent way to put it. Instead of thinking polished, think authentic, think honest. Those are the words that I use. If your story is authentic, if it's honest, that's what will resonate. People remember it when they tell, as you're telling your story, that it's something that's important to you. Because believe me, they will know somebody that may affect, and that will be amplified when you share it honestly and how it's important to you. When it's too polished, people know when things are too polished. That does not come across very well at all. The comfort part that you spoke about, Scott, is extremely important. Sometimes when I'm going to give a talk on a topic that maybe it's the first time I'm speaking on something, I bounce it off my husband or a friend or a relative, not necessarily another healthcare professional or one of my clients. I bounce it off somebody who has really no other skin in the game to hear what I'm saying, to make sure that I'm sounding like I'm relaying the story comfortably. And I think that that's really important.
Yeah, I love that. And I also think it gives people an easy thing to remember. It's not about polished, it's about authentic. And I think we can be authentic without too much work. In fact, it's probably even the less work we put into being authentic, the more authentic it is.
Absolutely.
It's a great memory.
Absolutely. I think that one thing that DPAC did prepare us for in giving these, I don't know that they use the word authentic. That's my take on everything. But what they did prepare us for is time. So if you know that you have a limited time to share in a town hall meeting or maybe a virtual meetup that you're sharing online or, in a Zoom meeting that can get the point across, you do have to practice getting your time in a certain space so that you don't get cut off and that your message does get shared. But keep it true to yourself. Keep it authentic. That's what people will remember. They'll remember you. They'll remember your story. I know that I do. Throughout the decades I've been doing this, I know I remember people who have authentic stories. That's why I'm an advocate.
Yeah, thank you. And that's a great call out to be mindful of the limited time that's available and be sure to prioritize what your messaging is.
Right.
DPAC offers one pathway into this work, but people may connect with different issues, organizations, or communities, such as you mentioned, all the different professional organizations that you're involved in. What would you recommend listeners look for when they're choosing where and how to participate?
Look at what is important to you. So if it's important to you in your diabetes life to look at any piece of it, whether it is medical nutrition therapy, obesity care, insulin access, affordability, insurance problems, whatever you think that the passion is, look for organizations that may be looking at advocacy at that level. And then take a little time, do a little research. It could be with your peers in the diabetes online community or in other diabetes communities, look at it that way. But take your time and look at those organizations under their advocacy. So the larger organizations, and I won't name them all here, all have advocacy arms. They all do. They have advocacy arms. And those advocacy arms do spend their time on Capitol Hill, but they also spend it locally. And they spend it in your town, whether it's in person or online. So look at what they're doing before you try to reinvent the wheel and see if there is something that speaks to you. You may see something that reaches to exactly what you are looking for, where they already have the advocacy outlined and you can get your updates and you can participate. And there may be a subgroup under that advocacy that you want to take a role in, maybe participating in a group or maybe more of a leadership role. Your call. It may not only be writing a letter to the editor or attending a town hall. Maybe you take the next step and make a phone call to your senator, your congressman, or your local legislator. It depends on what you want to do, but everybody should have a voice in this. And again, the more small voices we have, it leads to a big change.
Yeah, that's really great. And I'm so glad you mentioned that too, because it brings to mind that maybe someone who's listening, they're not someone who feels comfortable being out in front or on camera or going to the meetings. And there are still many ways that you can participate. So all of these organizations need lots of help, even behind the scenes. And so I really love your recommendation to just kind of check out these groups that are out there and find ways to get involved and even ask them, what do you need help with? And if I'm not comfortable going to a meeting or sending an email, are there other ways that I can get involved? I think that's a great message there as well. Advocacy can be slow and emotionally draining, especially when someone's already carrying the daily work of diabetes. Do you have any thoughts on how someone might set some boundaries recognize progress within this slow work and stay involved without turning advocacy into another big, overwhelming responsibility in their life.
That's exactly right. There's so much that someone has to do who's living with diabetes, or anyone who is living with diabetes and multiple conditions, and life. There's a lot going on with life. So even though you may be thinking as an advocate that you want to do a lot of things, I always recommend starting small, starting very small, and keeping, I don't want to use the word expectations. I just want to say, keep what you think is going to happen in perspective. That's a better word. Keep everything in perspective. When I went to Hill Day, I purposely wore a blue dress with red shoes. I was going to be as apolitical as possible going in there. Even what I was wearing, like no anything. I just went in that way, keeping everything neutral, which is what we have to do. Even though the staff was of a Republican congressman or a Democratic senator, I kept it, in that way. And things obviously move very slow in Washington. So keep that in perspective. But when they hear these stories, we're seeing things very slowly move. And I want to say that I believe that it's the work of the advocates that help make that wheel turn. And that's what you can do. Remember, it can be very small, and it should start out small without you feeling that it's time-consuming or overwhelming. But it has to continue. So I came away thinking about what I can do next, whether that is writing letters, staying active on social media. I think I just posted something small yesterday on LinkedIn, just about keeping people up to mind of keeping up with promoting these bills and sending letters about these bills to make sure that it just doesn't end there, because it never ends. There's just always something else that we can be doing to improve lives of people living with diabetes, not to make it more burdensome by taking more on.
Yeah, very well said. As we begin to wrap up here, I want to come back to the listener who may still be thinking, "Oh, I'm not really an advocate." What would you want that person to understand about the value of their experience and their ability to contribute?
Your story matters. So please share what's important to you to people who really do care, whether that's in a very small way in a social media post, resending something in a social media post, or looking at a toolkit from any organization, including DPAC, only because I just got my updated toolkit that's on my mind to look at, and look at something that might work for you, or attend something locally in your community that you may find impactful. But you do matter, and you are important. And if we just sit back and don't do anything, nothing is going to change. And that's for sure.
Yeah, again, very well said. Where can people connect with you if they want to follow up on anything or learn more about the great work that you're doing?
Well, thank you so much. Email me. I'm great with email. My email is susan@susanweinernutrition.com. So anytime, reach out. Scott will tell you I'm easy to find. So just reach out and I will respond.
Amazing. Thank you so much, Susan. It's been really great having you on the show today.
Thank you so much. And thank you for this opportunity. It was awesome to catch up with you.
Susan, thank you for sharing this experience with us and for helping make advocacy feel less intimidating and much more human. As you shared, advocacy doesn't have to begin in Washington. It can begin with one issue you care about, one part of your experience you're comfortable sharing, or one small action that fits your life. You don't need to understand every bill, respond to every alert, or become a full-time advocate. Your voice has tremendous value no matter where you decide to use it. Again, we'll include links in the show notes to DPAC and the other organizations and resources where you can learn more, explore current issues, and find a way to participate that feels right for you. Until next time, keep living well with T1D.